Hello! I have a short video today about transitioning from pre-nursing to nursing. When I was going through this transition, I really wanted to know more about what to expect and what to review beforehand, especially from the perspective of someone in Canada. I hope that some of you find this content helpful if you're looking for some insight on transitioning from pre-nursing to nursing in a Canadian school. As there are a lot of schools in Canada with varying requirements in pre-nursing, I'm going to be general. Basically, with your pre-nursing courses, you're looking at doing a couple of anatomy and physiology courses, some sort of math course like statistics, and critical thinking courses like philosophy, psychology, English, or sociology. The ultimate goal is that the combination of these courses will prepare you for nursing. Let's start with the math course. Obviously, you don't need calculus in nursing. The 4 basic operations of math will do in the clinical setting. But other than that, one of the math courses you may be required to take is statistics. Why is this helpful and what should you pay attention to? You will most likely be reading a lot of articles and experiments related to nursing, and where statistics comes in handy is when you have to decide whether what you're reading is credible or not. How do the methods and analysis sections of the study look? Did they use enough participants? What do the calculations mean? What does this conclusion mean? What does the p-value mean? The biggest takeaway from your statistics or math course should be how to analyze trends and how to determine the significance of a study's results. Many of your theory courses in nursing may ask you to write papers and essays on current nursing studies and their impact on your nursing practice. By understanding the basics of data analysis, you can come to statistically valid conclusions with a rock-solid rationale to back you up. Okay, what's next? Critical thinking courses like philosophy, psychology, English, or sociology. Apart from being super interesting, these courses give you the opportunity to practice your critical thinking skills, which is so important in nursing. These courses allow you to think deeply about a given problem. Other than the concepts and facts that you can learn in these courses, how else will you use them after pre-nursing? Well, let's think about it. Your patients are complex people. You need to consider so many different things as you're caring for them. What is influencing your patient's physical health, their mental health? How are your values influencing your treatment of patients? So yeah, these courses allow you to think critically and reflect on your nursing practice while in school and possibly after graduation. Lastly, your anatomy and physiology classes are the most important for obvious reasons. When you start your nursing courses, you will begin to learn about disease processes, medical interventions, surgical interventions, and so much more. The more you know about the human body, the easier your pathophysiology and pharmacology courses will be later on. However, based on experience, this is what I wish I had reviewed before moving on from pre-nursing. The cardiovascular system. The structures within the heart, the difference between arteries and veins, the layers around the heart, and you know that cardiac cycle chart? This bad boy. The respiratory system. The basics of the lungs and VQ ratios, just because I felt like we focused more on the pharmacology aspects of respiratory illnesses rather than the pathophysiology. The renal system plus the liver. The big structures and how they're connected with the cardiovascular system. The kidneys and liver play a big role in drug metabolism, so reviewing them can be beneficial for your pharmacology courses. With regards to the musculoskeletal system, you don't need to know a lot. Nobody is really going to quiz you on the small bones within the skull or all the metacarpal bones or the small muscles and ligaments. So in my opinion, I think having just a general idea of where the big bones and muscles are in your body is enough. The digestive and endocrine systems. The structures and the functions of each structure. Immune system. Innate and adaptive immunity, role of the different immune cells. Nervous system. The cranial nerves and the different lobes of the brain, as well as what each lobe is responsible for. Integumentary system. Layers of the skin. Reproductive system. The main structures of the reproductive system and the basics of pregnancy. Like I said, these are the things I wish I had reviewed before transitioning from pre-nursing to nursing based on my own experiences. But if you're looking for a way to prep before starting your nursing classes, the basics of each body system is a good way to go. Good luck with your studies, and please like and subscribe.